All right, hello everyone. We're going to go ahead and get started. Thank you so much for joining in on our Health Links webinar series. Today we'll be talking about effective communication for motivating teams. I wanted to introduce myself. My name is Katie Guthmiller. I'm the program coordinator at Health Links, and we'll go ahead and get started. One minute, okay. So a lot of you are already in our Health Links network, but for those of you who are not, I wanted to tell you a little bit more information about who we are. So Health Links is a nonprofit program based at the Center for Health Work and Environment at the Colorado School of Public Health. And we offer evidence-based healthy workplace certification as well as advising to help organizations and their team members achieve total worker health. I wanted to talk to you a little bit about the Health Links benchmarks. I just mentioned the term total worker health. If that's not familiar to you, that's okay. What we're mainly talking about is the integration of health and safety with the overall goal of helping your employees improve their overall well-being. So how we do that in Health Links is we assess and advise on these 6 different benchmarks. I won't go into all of these right now, but just wanted to point out that our topic today of communication would fall under our engagement benchmark. Just wanted to do a brief agenda for you all. We will have an introduction from Lili, Tenney, and our presentation today is from Dr. Shelly Campo. We will then transition into a panel discussion with a couple organizations in our Health Links network, Ground Floor Media and Center Table, and Douglas County School District. Then we'll have a little bit of time for Q&A, and we'll leave you with some last tips and some closing remarks. Some general housekeeping before we get started. All participants will be kept on mute throughout the duration of the presentation. If you're having any technical issues, please use the chat function and I will help you work through those. If you have a question for our speakers or panelists, please use the Q&A box. You can do this at any point throughout the presentation and then we'll address those questions at the end. I did want to let you know that this webinar is being recorded and I will be uploading this to YouTube afterwards and sending you all the link in a couple of days in case there was something you wanted to review or if you wanted to pass this on to other colleagues. There will also be a survey at the end of this webinar. As soon as you close out, we would really appreciate if you take a minute to complete this. This helps us to inform our webinar series and just continue to make it better for you all. If you weren't already aware, we are offering SHRM, CHES, and CSP credits for attending this webinar. I will also be including information about that in our follow-up email that we send out in just a few days. So stay tuned for that. All right, now I wanted to tell you a little bit about our awesome speakers we have for you today. First is Lili Tenney. Lili is the Associate Director for Outreach at the Center for Health Work and Environment and a Senior Instructor at the Colorado School of Public Health, where she teaches graduate courses in the Department of Environmental and Occupational Health. Her work focuses on total worker health and public health practice. She has over 9 years of experience in research, translation, and dissemination, program planning, leadership, and partnership development. Lili is the co-founder and director of Health Links, and she speaks nationally about the importance that organizations and leaders can have on impacting communities and creating better, healthier jobs for a healthier workforce. And then we have Dr. Shelly Campo. Shelly is an associate professor in the departments of community and behavioral health and in communication studies, and is also the associate dean of the Graduate College at the University of Iowa. Dr. Campo serves as the outreach director of the Healthier Workforce Center of the Midwest, one of 6 NIOSH-funded total worker health centers of excellence. Her research and teaching center on health communication and social marketing, and she has received national and international awards for her health communication work. So we're really excited to have these 2 wonderful women here with us today. And Lili, I will go ahead and pass it off to you to get us started.
Thank you, Katie. All right, everyone, welcome. Thanks so much for joining us today. I'm here to get us kicked off and to really help set the stage around engagement as far as how you can really identify a communication strategy. So employee engagement continues to be the #1 challenge cited by employers, cited by health and safety professionals, as far as finding the golden ticket for being able to reach and engage all employers to really, or all employees to really help them get motivated to change behaviors and take action in their health and safety programs. I hate to say gone are the days of coming up and posting flyers as enough of an effort to be able to promote health and safety on the job. But as far as where we're at across businesses of all shapes and sizes, there's been some evolution for these challenges and the need to identify some new solutions, which is why we're so happy to bring the communication scientists, Dr. Campo, but also 4 practitioners, which we'll introduce before the panel discussion today. I wanted to share some of the statistics, the why, as far as employee engagement and communication, and why it relates back to benefits for both organizations and workers themselves. There have been studies that have shown, this is from Gallup, that disengaged workers have 30% higher absenteeism, 49% more accidents, and 60% more errors and defects. So we know that there's a direct impact between engagement and having healthier, happier, safer workers by some of these really tangible, quantifiable measures. Organizations with low employee engagement experience lower productivity, profitability, job growth, and even business performance over time. I think all of us have worked in places where we know an engaged worker from an unengaged worker, and the difference that can even have on the day-to-day interactions and connections with coworkers. So what's changing, and why is this so challenging? Across different workforces, we're more distributed, we are more mobile, there's more distractions in the workplace regardless of your roles and responsibilities. There are a ton of different audiences and communication styles, and trying to figure out how to talk to each individual personally and connect with them requires a lot of different strategies. There's need for more employee involvement. So rather than coming up with push marketing or communication strategies, there's now real focus, as Shelly will discuss, on how we can solicit impact and give frequent feedback. There's the appeal of storytelling and really connecting with the heart and the worker. There's the demand for convenient, interesting, and fun. So suffice to say, there's a lot to consider. And at the end of the day, we're really trying to identify who's the best person to deliver the important information. So for example, if there's a safety announcement to be delivered, is it going to be more effective delivered by a worker who is affected by an incident or the company owner? And considering who your influencers are. So to get things started, I also wanted to highlight the range of generations, and this applies to audiences and communication styles in the workplace. This was a study done by Pew Research Center showing that there's a lot of technology out there. 67% of all downloadable apps are intended for communication, but that people under the age of 35 feel quote, need for instant gratification and have a quote, loss of patience. So there's this sense of what's in it for me as we consider how we want to message total worker health in practice. So with that, Shelly, I'm going to turn it over to you, and let's look forward to this presentation before our panel discussion.
Thank you, Lily. All right, can you see the screen okay? Yes, we'll nod, yes, thank you. So I am at the University of Iowa, and my background is in communication and sociology and not public health, and you'll see that that causes me to kind of think about things differently. I certainly believe that we have an awful lot to learn from businesses, marketing, the social sciences about how to more effectively change the behaviors and health and safety outcomes and the well-being of our employees, as well as the workplace itself, to be more worker-friendly. And all of those things have benefits. So one of the big issues that I think a lot of us face is that we spend endless time in meetings that have goals of doing some kind of good public good or good for our employees, but we get increasingly frustrated because it seems like the meetings actually don't result in anything, or that the efforts are not well heard, either by the audience or management in some cases. And so I want to talk today about strategies and approaches to increase impact, and will be obviously more helpful in keeping people engaged, including the work committees themselves. As Lili said, I'm at the Healthier Workforce Center. We are based, actually, the primary location is the University of Iowa, and we serve Iowa, Missouri, Kansas, and Nebraska primarily. And there are 6 of these total worker health centers in the United States, and Colorado is one of the others. We partner with lots of organizations and a number of businesses who are not on here. But our major partners are Washington University in St. Louis, Workwell, Kansas, the Business Health Coalition, which is in St. Louis, the Nebraska Safety Council, which also houses Workwell, Nebraska, and so I want to acknowledge them. So could you put up the first poll question for me? So
Yes,
how many of you have heard about social marketing?
Okay, just launched the poll. Now wait a minute to get some responses here. They're coming in. All right, looks like it's starting to slow down, so I will share those results.
Oh, lots of you. That's great. All right, so I don't have knowledge questions. So I'm betting that you have heard of it, but some of you have used it fully and some of you have not. So it's basically taking the principles of commercial marketers. So what can we learn from Pfizer and Coca-Cola and Google that we can use in our own efforts at local levels to try to figure out how to increase the effectiveness of what it is we're doing? So what are the best lessons from them about, how to change things? And what we find in the literature is that it's a combination of things. Several of them are about the need to use data to both drive decisions and show impact. Some of it is about really understanding your audience. Some of it is about how you manage your resources, financial, personnel, etc. Some of it is about the competitive environment. Some of it is about what it is we're asking people to do. And then there's a lot around what's called the 4 Ps, which some of you may have heard of, which is price, product, promotion, and placement. So the more communication-related aspects of this. I will say that I believe that there are common errors that a lot of teams make, and often it's for reasons that feel like they're altruistic or good reasons. We want to do something quickly. We don't want to waste people's time. We understand we have a low budget, and so we think we know our audience better than we do, and so we start skipping these steps and not fully considering all of the aspects that might actually apply. But there are good reasons to at least show some level of attention to all of these areas as we think about the efforts that we're making to try to improve safety and health outcomes for our employees. One of the big reasons is failure in pre-program data gathering. So we think we know what's going on. We don't really investigate it. We don't get really down to the deep level. So people are reporting that you know, X or Y is occurring, or we perceive people in the workplace. We can visually see who's overweight and obese. And so we guess that those are the issues we should work on or care about. And that may or may not be the right way to go. But it's really important to do a deep dive analysis of both whatever that health thing is, health or safety problem or issue is, as well as to look deeply at your audience, because your audience is not one thing. They do have the thing in common that they all work for your organization, but their motivations, their backgrounds, their attitudes, their beliefs, you know, their lives, their families, their communities may all look different from each other. And so understanding how different people perceive things can be quite important. I do think folks have a lot of data at their disposal that they don't always consider. And so often organizations have a health committee and a safety committee, but those two groups do not always talk to each other, nor do they often talk to HR, which has a whole other slew of data that can be helpful. You know often what people are coming to, participating in, telling you anecdotally, etc. And so looking at all those sources of data and understanding that they're interrelated. So we know that healthy workers are safer workers and safer workers are healthy workers. And so those two things are intertwined. So if you have a health program, a wellness program, it actually can impact your workers' compensation claims, can impact them from the standpoint of fewer injuries or quicker return to work or a less severe injury, etc. So you really want to do that. The other thing is to really get at the root cause. So you may be seeing patterns in your data, but if you don't do a deep dive, you don't necessarily figure out what here is going on. And so let me give you an example. If you find that there have been a number of a certain kind of injuries going on, then your immediate conclusion might be, well, we need to train the workers in how to do a certain kind of behavior, or just give them information about you know, the need to do more workplace cleanup to avoid trips or falls, or, you know, wear their respirators, etc. But what if we dug into that further, and what we discovered was that all of those claims were occurring in the same shift. So, you know, you go a little deeper and you find out, oh, it's all third shift. What if you go a little bit deeper and find out the injuries are all in the same work group, and that they all happen at about, you know, within the same kind of time frame? And so what you might start to discover is that all of it goes back to a particular supervisor. Not necessarily the workers, but a supervisor who maybe is undermining efforts for people to engage in safer behaviors, not modeling those safer behaviors, him or herself, etc. And so those kinds of things are really important. Let me just stop here for a second and ask a second question, because we're going to talk more about data as we go along. So how many of you use data to drive decisions, and how often you do that? So why don't we put up the next poll question?
Okay, I'm launching that poll.
Yeah.
Lee, you have your slides in presentation mode right now. Is it possible to put them in full screen while we're getting these responses?
I can see if I can do that.
Great, thank you.
Yeah. First, I got to find you. Stop share. Is that what you want?
Oh, no, just you can just share the presentation, but just not in presentation mode.
Oh, hold on.
We've still got some responses to the poll coming in.
All right. Oh, I skipped question 2. Or yes. That's all right. We'll take this too.
All right. So I'm sharing the results.
Yeah, this one is about leadership support. That was an oops. Okay.
Okay.
That's all right. Put it back up.
Oh, okay.
Okay. So we got leadership is supportive some of the time for about half and about always for about half. So you folks that have always supportive leadership is great. I don't think you are typical of most organizations nationally, but that's an excellent thing. All right, we had a question too about data. Do you want to put that one through? Okay.
All right, responses are coming in. We'll give you all a minute to respond. All right, looks like it's slowing down. So I'll share those results.
All right. Again, half of you do it all the time. Super. Okay. All right. And it's great if you can use multiple data sources to really kind of triangulate the problem, because what your employees tell you is the problem, what your compensation data tells you is the problem, what your supervisors tell you is the problem, could potentially all look quite different. And so really trying to get at the root cause is important, and to define what really is truly going on. We also know that we have failures that we can point to in thinking about who the audience is, and this goes back to some degree to the last point. So if these injuries and so forth are occurring in the third shift, then the group that we need to pay the most attention to is the third shift. And so one potential audience segment is to realize that third shift is who your potential audience is. Again, if you go a little deeper, you might find out the real audience that you care about is supervisors, to again make sure that they're being retrained with the kinds of messages that they're delivering, the kinds of behaviors they're modeling, etc. Often we do not pay enough attention to audience or thinking about audience. And audience can be a whole lot of different segments. They can have different levels of motivation, different backgrounds, different readiness to make changes. And often one of the audiences people do not pay enough attention to is leadership, particularly if they're not on board. So if you've got half the people in this audience who their leadership is not consistently on board, one of the major targets for your efforts should be on senior leadership and supervisors, middle management, etc., buying more into the process, because it does not help when they undermine whatever efforts are going on. And so you want to make sure that you're doing this in tandem. You want to involve as many people as you can in the process, but you also have to balance impact and efficacy. So the bigger your audience gets, the less effective you are. You can do a lot more at the one-on-one level of, personal coaching or, directed communication efforts between your human resource director and a CEO, for example. But if you're trying to reach all employees in a 5,000 person organization, your messaging is not going to be anywhere near as effective. So the impact will be on a smaller percentage of those people. If it's more one-on-one, your chances of impact go up because you can really tailor what it is you're talking to. I also encourage you to think about audience segments that businesses don't always involve, and that can include families or community organizations, places of worship, other kinds of places where we are seeing some overlap, other local businesses in your area, etc. And I will provide some examples of that in a minute. I think it is equally important to pay attention to both the health or safety problem and also to the audience. And people who have a background in the health sciences tend to think that the health issue is incredibly complex and spend a lot of time there. People who come out of the social sciences and human resources area know a lot about people, know less about the health issues, and they see that as incredibly complex. They're both complex. And for health communication to really be effective, what you want is that to be giving equal attention and understanding the complexity of those two things together. Resource management is another area where people have struggles. First of all, people either, they often think either I don't have enough money so I can't possibly do anything effective, or they throw a lot of money at something and it's completely ineffective. And there are lots of examples of national campaigns that have really had major missteps in providing too much money and not having, for example, done enough testing of the materials and wasted a ton of resources. So some of you may remember there was a national pre-diabetes campaign that was done about 2 or 3 years ago. CDC and the ADA and some others, AMA were, American Medical Association were sponsors of that. And one of the ads in particular actually caused some level of backlash from patients because their effort was around sort of trying to educate people about the importance of prediabetes and early diagnosis and treatment and management. And a lot of the management at that point is behavioral. And there was a commercial in which they showed a doctor interacting with a female patient. And then the doctor started making fun of her because she said the reason she couldn't do what he was asking was that she was a busy mom. That did not go over particularly well, but millions of dollars were invested into that effort. And luckily they had a lot of other materials that worked a lot better. But just because you put in a lot of money does not mean it will work. Similarly, there are smaller changes that you can often make that can have quite a bit of impact. Just looking at policies around sort of managing worker time off, a little bit of flexible scheduling, job change situations in some cases. It takes resources, but it might not actually take it might take less resources than individual level education. There was a study done by a student at the University of Iowa a few years ago looking at hearing protection efforts for people who worked on farms. And what she found actually was very intensive interactions where you would provide a lot of education to employees were not actually any more effective than just putting hearing protection located physically where it is that people needed it. And so, you know, having that available was a lot cheaper actually than all the educational efforts would have been on a large scale. So we want to actually look at thinking about how you can leverage funds. You want to think about budget ahead of time. You want to scale things to your budget, but budgets can also grow. Sometimes the pie is not as limited as you think. If you have a partner with a community organization who can provide time or facilities or other kinds of things, you may actually benefit from that. Cost-benefit analysis can also be important, and so really considering where you should put your efforts in terms of individual or employer or community is important. We have a lot of failures in terms of forgetting to consider the competition. So we have all kinds of educational efforts within a lot of workplaces to try to get people to eat healthier, but we don't always examine what's in the vending machines. For workers who work outside, they may not have access to be able to keep food safely, and so they often end up not drinking enough water, having too much junk food because it's got preservatives or other kinds of things in it that you could get at by sort of trying to change those kinds of environmental issues to support the behavior. Another thing is over focus on individual employee behavior, and I've kind of alluded to this already. So changing individuals is slow. Knowledge, attitudes, and skills, and it's not unimportant, but if we can change other kinds of things around the individual, we can actually impact behaviors for a lot of people at once. The other issue about this is that individuals get tired of what they feel like is blame. It's your fault you're overweight. It's your fault you had a slip, trip, or fall. It's your fault that, you know, X or Y happened to you. And so we need to also look at what we can do to the environment to try to redesign the environment, to substitute things, or to eliminate unsafe working conditions or conditions that are contributing to health problems. So if you have a lot of employees who are out with respiratory illnesses, and your answer is just to, you know, have them go to the doctor to get allergy medication, asthma medication, etc. But what's really causing the problem is air quality within your workplace, and that you need to actually install fan systems or other better ventilation systems. You can actually impact everybody's health simultaneously in good ways.
Sorry, I don't mean to interrupt. Just wanted to say we've got about 3 minutes left.
Sure. And then we have a number of failures in program design. Often those are around the ask being unacceptable or not convincing. So we're asking the change to be too much. So for example, there's been a lot of recent press about, do people really need to walk 10,000 steps? And you know, people who are sedentary all the time, 10,000 steps is asking them to walk 5 miles, right? So can we do things in smaller ways, chunked out, and so that people feel like that they're attainable, that they change something, and you can see quick wins. Lili talked about sources. Who should that information come from? Do they trust people, etc.? That's also important. People need to be testing these kinds of things on a regular message, and understanding that one channel or a particular channel may not be helpful in these cases. So a poster, as Lili explained, may not be enough, but a website that people actually have to go to, if they're not motivated to learn about the topic, they may not go. So you have to kind of look at the fit of the problem. There's not going to be a one-size-fits-all solution for all kinds of organizations. And then we see lots of evaluation failures. We don't really pay attention to see whether or not what we're doing is being implemented in the way that we intended. So are actually people viewing the information, participating in the trainings? Are we monitoring data to see if air quality actually changed? We need to look beyond return on investment to look at value on investment, particularly in small organizations where one injury can really change your workers' comp situation, and so we want to consider that. But you also have to have realistic outcomes based on what your goals were, and the kinds of stages that your folks were in to begin with. So you know, it's not necessarily likely that a single tweet is going to result in 5 people not being injured, but we have to set realistic goals. The Healthier Workforce Center has lots of free resources that are available to you, and I would encourage you to go to our website. You can learn more about a number of the kinds of topics that we have talked about. And a lot of our educational materials are under 7 minutes of your time. So we really focus on sound bites of education. So we have a podcast series and a video series around ways of implementing and thinking about these kinds of issues, as well as more in-depth dives about specific health topics related to different kinds of focus of interventions. We're about to release some podcasts around marijuana in the workplace, around inclusive design, and some other kinds of issues. So I really encourage you to check us out and help yourself to anything because we're free.
Awesome. Thank you so much, Shelly. If any of you have questions for Shelly, please use the Q&A function down below to put your questions in. And again, at the end, we will address all of them. We're now going to transition into our panel discussion. As I mentioned earlier, we have two organizations that we work with links here, Ground Floor Media Center Table and Douglas County School District. From Ground Floor Media Center Table, we have Amy Moynihan, the Senior Director of Communications, and Christina Riley, the Vice President of Business Operations. And from Douglas County School District, we have Holly Hedon, the Staff Wellness Coordinator, and Rosa Reynolds, the Benefits Manager. Lily, I'll go ahead and pass it off to you to moderate.
Great, and thank you, Katie, and thank you, Shelly, for a great presentation. So here we have 4 individuals representing 2 organizations that are really at this.
Sorry, Lily, you're frozen right now. We'll wait a second, hopefully get your service back on. There you are. All right.
So let me start over. So I want to dive right in with our first question and start with Rosa and Holly representing Douglas County School District. What is your primary goal with communicating to employees about health and safety?
Hi, and thanks for having us. We are a really big district. We have 8,500 employees, and that's difficult to express that we think everyone is important, but we do. So that is our goal. Through that, we just want to make sure that they know that when they come to work, that they matter, and we value them as a person and as an employee.
And just to piggyback on that, we have multiple mechanisms to communicate. I think one of the components of this is that we are multi-generational. So essentially we're hiring people from out of college at 22 to people who are seeking a second career and are 75. So we have to make sure to keep that in mind when we communicate. So not only is it through email, but it's also being present and showing up at sites and letting them know what options they have available through our health programs. So ensuring that they have the message and that we also provide it to their site. And while right now that isn't popular, but we do provide paper copies that they can put up on a board. And that's not always a popular mechanism to use. However, we just have to keep in mind that we are communicating multi-generationally. It isn't just one age group.
Oh, we froze her.
Yes, sorry, it looks like we're having some technical difficulties, but we will go ahead and hear from Ground Floor Media.
Hi, thank you. For us, the challenge is a little bit, the importance of it is obviously we want our employees to know that we are incredibly concerned about their overall health and safety. The safety component is a little difficult because it, as a small business, I think the term safety, a lot of people think of occupational safety and not some other things. So we really just, we want to make sure that we are constantly expressing our commitment to their health and safety, and then providing them with outlets to back that up. So whether it be programming or whatnot. And then also too, just making sure that all of our policies and procedures reflect our commitment and are in places that are accessible to employees, especially with a company like ours where we have a mix of both full-time employees as well as contract employees. We have people that are in the office daily. We have some people that we see once a month or maybe once a quarter. So just making sure that we are communicating among all channels to reach everyone. It sometimes can be a little challenging, but we're up for it.
Yeah, and on the flip side, we're an agency, so we work with a lot of organizations and businesses, and a lot of what we do on the employee engagement side of things is help them figure out what communication channels. I like that Shelly had talked a lot about audiences in her deck, and that is really critical when we're working with our clients to figure out when it comes to health and safety and working with our HR departments, or whether it's with the marketing department to get information out, or even the C-suite. Who are their audiences? What are they trying to reach? We do a lot of healthcare work. So, maybe there's a hospital that has clinical staff that are in at different times and different shifts. It could be, we work with a forestry team and they have folks that are out that are not on email like ever. And so how do we figure out when there are policies that need to be put into place and communicated, how to reach them by audience and then also by communication channel.
Great. So picking up on some of that work externally, but also what you found in your own company to work best as far as reaching all employees, whether they're in the field and never checking email or at a desk 40 hours a week. What have you found to work best as far as getting them to respond?
Great question. So, Lili, I think you mentioned in your deck, I love that you had a bullet saying make it fun. And we like to do that because it's always challenging. I think we're in an information overload age, and a lot of times it is that face-to-face or the small groups. We have found with a lot of, even internally with we're a small business, but we do a lot of communication around food. And it's a simple thing, but bringing in burritos for breakfast or having a lunch, people have to eat. And usually if you're feeding folks, it's a good time to have some communication. That's just one example.
And we also have just kind of a just do it. We had an example the other day. We remodeled our space recently, and we were joking about something being on fire, and someone's like, I don't even know where the fire extinguishers are. And we were like, everyone stop, quick back up. Let me inform you that we do have 3 fire extinguishers in the building. Here's where they're located. And those are kind of silly things that I think sometimes when we think about health and safety are not forefront in our minds as for what we do for our job. But then when those moments come up and realizing that that is something that we need to make sure that all of our staff is aware of. So taking those moments when the opportunity arises to reinforce it, and then also noting that we probably need to have something somewhere documented that we share with people so they know some of the health and safety things that we're doing.
Great examples. Holly and Rosa, how about you with in the school district, bus drivers, teachers, supervisors? What are you finding that works best as far as reaching all of them and getting them to engage?
Well, you're right. It is difficult, and I love that opportunity for play. And we were just talking with someone who just introduced where all of their fire extinguishers were and their AED and, all those things that people are like, blah, 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 their eyes are turning over, but they did it in a fun format, and they did it like a trivia question, kind of like what we just did with Shelly, where they had to answer, do you know? And it was really cool. And it, people were laughing, but it was just a fun way to do that, which is how we try to communicate with our employees. We find that if the communication comes from someone that they are working directly with, it is much better received, and they're able to interact with that person a little bit better. So what we do is we have wellness champs that work with our staff wellness and benefits team, and they're our liaison, and they work within our buildings with our staff. So they're able to communicate really important information, but also communicate some of those fun things. How can we improve as a team and our culture and our climate, things like that. So that's kind of what we do.
Yeah, we just make sure and partner with some of the schools, and what we've come to realize is here at our school district is oftentimes with these folks that are their peers, but also the school secretaries are the heart of the school. So if there's something that's pretty important, typically those folks go directly to that school secretary and they'll have that information. For some of our other areas, such as our transportation team, they have screens that are providing information. So they'll go into their lounge and they'll see a screen that has information that'll be relayed to folks. So not only is it peer-to-peer communication, but there's also other mechanisms that we try to utilize to get information to folks. And just having it be lighthearted is always fun. Even if it's a little bullet point or a little joke, people are more likely to pay attention to it than a paragraph of information and statistics.
Awesome. So before we open up for Q&A, just a quick ending question around, in this, as you mentioned, this, Amy, this information age where we're just being bombarded. Can you just quickly summarize what your organization is doing to continue to really synthesize and stress the health and safety of employees as a top priority amongst everything else we have going on?
Sure. Yeah, we've definitely found that consistency is key. And that's hard because, like you said, there are apps, there are social media channels, there are policies and procedure handbooks. So we try to make sure that we are being consistent in our communication and that all of us are singing from the same song sheet. We do also do something similar to what the folks at Douglas County mentioned about, making it fun and quizzes. And we have done that in our staff meetings of, if we want to remind someone of a policy, we'll review it in a 5-question quiz, things like that. But we've also, again, it's when those moments pop up where we're like, oh shoot, we don't have something for that. Taking it back to the group and saying, what can we better do? And how can we use technology with us being being spread over multiple places and not always being physically in the office? We had a case, I guess it was last summer, where there was an active shooter in downtown Denver. And we didn't know where people were. And it was that moment of, wait, well, shoot, what do we do? And we didn't want to panic anyone. So we were kind of piecemealing it together as we went. And then it really made us aware of the fact that we probably need to communicate with our staff that if something like this happens, we're going to send out a text message and we would like a text back, just ways for us to communicate or keep track of people. And so we did kind of talk through with our staff, what would be the best channel? What are you most likely to look at? And developed kind of a procedure from that. It's not necessarily something that is plastered in a handbook or whatnot, but it's something that we know from a procedural standpoint how to handle. So I think it is knowing your audience, recognizing what tools we have to communicate, and then working with them to figure out which is going to be the most effective.
Great.
And I'll add on to one of that, being consistent, really, really important. The other thing is keep practicing it, keep bringing it up. We, as silly as this sounds, but putting the alarm on in our office is always the biggest challenge, and figuring out how to turn it off. And, is there people in the building, like all of this, because again, we're a small business. And so we actually have a buddy system where we paired people up to actually walk through physically unlocking the door, setting the alarms, and people were having fun with it because it was kind of silly. But then we're like, the poor front desk person who gets the call every morning when somebody's there early and doesn't know how to turn off the alarm gets annoying. And so it was one of those, we need to start putting things more into practice and have people actually go through the process.
And another challenge that we have, which is a good problem to have, but we have actually a very low attrition rate. So we are not onboarding people with some level of regularity where the policies and procedures are being stated over and over again. So sometimes it is reminding someone who may not have actually looked at an employee handbook for several years of some of the things that we have in place, or some of the benefits we have, or making sure that they understand the full breadth of resources that are available to them from a health perspective, and then also some things that we do consider for safety. We are in our cars a lot, so we really want people to understand that we want you to pull over and dial that phone call versus one handing it down 36. So just things like that we just, we realize that we do have to kind of remind people of, because we all fall into our bad habits, and if we're not revisiting them, they continue.
Great. Well, we've had a couple of great questions come in. I want to make sure we have a chance to answer them and give you all as panel members a chance to answer them as well. So Katie, I'll go ahead and have you run through these questions. Thank you all very much.
Thank you to our wonderful panelists. I'll start going through some of these question and answers, and participants, if you have questions, please feel free to submit those now. So the first one that we have is, do you have any easy suggestions about how to specifically engage leaders in health and safety communications? Leaders can be so busy and pulled in so many directions. What are some strategies to get them to communicate the total worker health message? And whoever wants to start with that one.
I will say some of it, we did not talk about this, but most communication is actually nonverbal. So it's not the things that are said or written. It's, you know, how people behave, how they attend. Do they actually model the same behaviors you want them to actually illustrate? So are your leaders actually, drinking enough water and doing it in visible ways? Are they, taking a break and a walk? Are they, do they look completely stressed out? Do they look like they're managing what it is they're doing? And so I think if you can find ways to immediately try to get the nonverbal behaviors to line up, that can be helpful. I also think you have to find the hook with leaders individually about what aspect of this they really engage in. So they might engage more with some of these topics than others. And maybe if you pick one of those up front and then, you sort of, give them a little bit of a carrot to be involved, they're going to find that working with you on more topics might work. Or understanding that topic A is really actually related to topic B and they're interested in topic A. So it's really sort of crafting the persuasive message to figure out what the motivation is for that leader and how you can actually capture that.
I think, and I just want to add, and as silly as it sounds, just speaking from our own group, we schedule it for our leaders. We want to acknowledge that it's not necessarily that they don't care or prioritize this, but to the questions point, they struggle with time, and so really getting it on their schedule as far as having them speak in behalf of meetings or have them meeting with people or participating in activities, working with them directly or whoever manages their schedule to get it as something that's on their calendar frequently.
Great.
And some things don't actually add time. So, leaders could learn to, use walking meetings or, standing meetings or other kinds of things that, they could still be engaged in the meeting and getting the work done, but they're also, showing a behavior that, we want them to show.
Right. Holly and Rosa, did you have something to say?
No, I was just going to add to that I totally agree with Lily. I was going to say we do schedule that. We also really do make it a priority for our staff to go through safety trainings, not just for their physical safety, but for their psychological safety. We want to make sure that they feel safe when they come to work. And I'm sure many of you, that work or listen to the news, that public schools are under the spotlight of safety, physical safety, and psychological safety for not only our staff, but our students. So we really do pay attention to that safety piece, and our leaders absolutely are on board with that. And so our trainings do come out every year. They're mandatory, but we do them fun and we do them through a video, and it's interactive. They have to answer questions and they have to pass in order to continue on with that, which is really great. But that is leadership buy-in. Those are things that are updated each year, and they are getting better and better, and they are not old school trainings. They are everyday trainings because it is real. And then the other piece to that is that we are in the middle of rewriting our strategic plan for our district, and safety and health, student safety, and also our staff safety is written throughout that, all over that theme. And it is really, really cool to see that, because that's not a siloed type of response to this. This is our whole entire district, and all of our employees believe in that.
All right, awesome. Thank you so much. We're going to move on to our next question here. How do you deal with naysayers in the group who don't agree with the information you provide, or say you want them to make changes that are not realistic?
I can jump in on that one. I've worked with a lot of organizations where you have those types of groups, and I always think, you know what, put them around the table. Let's get them involved, because once they're involved, then they feel like their voice is heard and they will make changes.
Get somebody to answer the question who they do respect.
Yeah.
So it may be that you just need to change the source of the information. So maybe they've heard it from you 5 times, but they need to hear it from their, friend or supervisor or somebody else.
Yeah, I think there's 2 types of naysayers. So just to play the devil's advocate, I think we're all eternal optimists on this topic, but the naysayer that isn't at a stage where they're willing to really be receptive, don't spend time on them. Spend time, focus your time on talking to the champions that are going to have a greater impact. If it is someone that's is saying that you want them to make changes that are not realistic, I think there's a huge opportunity to be able to solicit more feedback from a team-based setting, and make sure you give them some feedback about what changes you can make and what changes are realistic.
All right, great, thank you. We have time for one more quick question. The question is, how do you evaluate the interventions that you make, and do you always evaluate the new policies and procedures?
Ideally, you should always evaluate, because it also then allows you to provide evidence back to your employees, your managers, and other people that what you did actually has impact. So sometimes people believe that things don't have impact, and they do, and sometimes they believe they do, but they don't. But the more you can just keep reinforcing, we made this change, here's what the outcome was, then they're more likely to trust you on whatever the next thing is that you do.
Yes, I would say the evaluation piece is key, even though it's just one more thing for someone to respond to. But really looking at that evaluation from different ways. We do evaluations, that might be surveys, or we also do roundtable discussion evaluations. We meet with our employees and employee groups. That's an evaluation. Sometimes our principals are able to meet with their staff and they ask those questions. So that's an evaluation. So looking at it from different sources, I think is really important, because you hear different messaging that you need to hear all of it. So it's all really good to ask.
And I'd also say too that it's important to not just evaluate a new policy, but also to look back and figure out what has changed within your organization or your building or your facility that may warrant a tweak to an existing policy. Because sometimes, whether it be technology changes or, in our case, when we modeled our building, it changed a lot about where some things were for safety. We went to a different model of how we have desks versus offices and common area workspaces. So there are things that we have to look at in terms of ergonomics, and are we addressing those things? And so what we had done 2 years ago is no longer relevant to some of that. So sometimes it's not only just, it is just looking at everything and figuring out what needs to be updated and changed, just as important as, evaluating what new you roll out.
Awesome. Well, thank you so much. And thank you to our wonderful panelists and speakers. We really appreciated having you here today. I'm just going to leave you quickly with this slide here. So this is just kind of a summary of some of the things that we discussed today and some last tips for you. 10 ways to boost engagement with awesome communication. I'll leave this up in case you want to take some notes or take a picture of this. Did also just want to remind you about that survey. Once you close out of this, you will be given a link to the survey. If you could spend a second taking that, it's short, I promise. That would be a huge help for us. And then I'll be reaching out to you all in a few days via email to give you a link to the webinar recording, which will be on YouTube. Information about how to claim those continuing education credits, as well as a one-pager that we developed on creating a communications plan. So we thought that that would be useful for this group. So just wanted to say thank you so much for tuning in and have a great rest of your Wednesday.
Thank you.